Everybody uses refresh all the time now. Why do you say it's not good? I mean, is it okay to use eye drops every day?
Yes, everybody does use refresh. And that's because they have some amount of dryness. That's why you're using refresh. Now, refresh to me is a great drop, don't get me wrong, but it's a band aid solution, right? When you put a drop in the eye, it lasts in the eye for maybe 5 minutes.
Got it.
So when you're suffering from dryness, you're mentally putting a refresh and thinking, I'm okay, but your surface is okay for 5 minutes. You're not going to put refresh every 5 minutes, right? So, you have to understand that it's helping you for a very short amount of time in the day. Secondly, every drop has some amount of preservatives. Even when they say preservative free, it has some
Something.
solutions that you don't really need, right? So when you start using it at even 30 or 40 and you're living till a good 80 or 90, you're putting these drops year on year for so many years. That itself is damaging to the eyes. There was this belief that, dryness initially, when it wasn't a big deal, was seen in a small population of people. And we were like, okay, just put these drops, you're going to be okay. But today, so much research has been done that we have better solutions which avoid using drops all the time. So I would say first go to your eye doctor, get those solutions, and then think of refresh.
Got it. And what is when we use eye drops? Apparently everybody does it wrong. There's a correct way of doing eye drops, and I use eye drops sometimes also, but apparently I'm doing it wrong. And also something about the expiry date.
Yeah, so I mentioned the expiry date, like do not use expired eye drops. But people think that, suppose I've opened a bottle today and the expiration date is in 2026, that I can use it until 2026.
Right.
That's not true. Once you open a bottle, an open bottle is valid for 30 to 45 days.
That's all?
That's all. And once that is passed, then don't use it, Most of your eye drops, if you're using regularly, are going to be over by then. And the eye drops which you require once in a way, you have to realize you've used it for a week, you've kept it and put it away, but now that's not sterile anymore. So it becomes a place where bacteria can grow. So then after a month, if you again open it and use it, chances are you'll come with an infection.
Got it. You are a dry eye specialist. What is dry eye disease? Because it seems to be everywhere.
Yeah, so dry eye basically is when your eyes either make less water, or it produces enough water, but that water is evaporating very fast, or a combination of both. So to avoid dry eye, basically what you need to do is you have to take frequent breaks when you're on the screen, follow the 20-20-20 rule. You have to do warm compresses so that your oil glands start functioning better and it retains more moisture inside the eye. You have to protect your eyes with, your sunglasses, sleep well, eat a healthy, balanced diet. All of it contributes to dry eyes. However, if you're having any of the symptoms on this whole spectrum of dry eye, which could be simply a feeling of dryness, burning, itching, redness, extra watery eyes, tiredness towards the end of the day, or discomfort, go to your doctor so you can be diagnosed whether you have dry eye, which kind of dry eye you have, and get the proper treatment for that.
How common is dry eye disease?
It's very common. As literature shows that there has been a 300% increase in dry eye post-COVID. So almost half the population, if not more, actually has dry eyes.
And you may not even know it.
You may not even know it. So on your regular ophthalmic visit, it's always good to test for dry eyes, because if you're diagnosed early, you don't have to go in for any fancy therapies. You can do in-home treatments.
And what are the early warning signs that a lot of people miss for dry eyes?
Excessive blinking, not being able to sit comfortably in a room where there's an AC blast or a fan overhead, feeling tired towards the end of the day with regards to eyes, or even excessive watering. See, when your eyes are pricking or burning, patients know they have dry eyes and they come immediately. But when you're feeling tired towards the end of the day, or there's excessive watering, they don't think, that's not the first thing that comes to your head. They don't think they have dry eyes. They feel like, I'm just tired like the rest of myself, or if I'm watering, how can I have dry eyes? So these are the signs that patients actually miss and don't come in. So keep that in mind.
And are there any myths about dry eyes that we'd like to dispel?
A big myth is that dry eyes is nothing big and that we don't really need to do much for it other than put over-the-counter drops. That's a big myth. Because by and large, yes, dry eyes is not going to harm you in a very major way. But if you do nothing about it, it is going to cause blurry vision. It is going to hamper your lifestyle. It's going to cause issues with surgical procedures later on. And you're not going to be a very comfortable patient. So, a big myth is that you don't need to visit a doctor for dry eyes.
All right.